Welcome, everyone. I'm excited that you're all here to join us for what promises to be a rich and insightful webinar on policy engagement. We have with us today 3 experienced policy engagement practitioners representing 3 institutions in Argentina, Kenya, and India with strong legacies of engaging policymakers and policymaking processes in order to encourage the creation of political commitments, policies, and laws based on evidence. Our speakers are Ezequiel García Elorrio of the Instituto de Efectividad Clínica y Sanitaria, the Institute of Clinical and Health Effectiveness in Buenos Aires, Argentina, Fatuma Guleid of KEMRI-Wellcome Trust in Kilifi, Kenya, and Soumitra Pathare of the Center for Mental Health Policy and Law in Pune, India. The format of the agenda for the webinar is as you see on the screen. We're going to have 10-minute presentations from each speaker. Ezequiel will be walking us through an introduction to policy engagement, and then Fatuma and Soumitra will be giving presentations of the experience of their institutions in this field. Then we will have perhaps a 10-minute discussion between our 3 speakers, and then we'll open out for questions for about 10 to 15 minutes. This in front of you is the registered interest in today's webinar. This is the spread of countries from which people are registered to join us here today. Very high representation of Kenya. Okay, so we will now start with our first presentation. Dr. Ezequiel García Elorrio is the director of the Department of Quality, Patient Safety and Clinical Management at the Institute of Clinical and Health Effectiveness, ICS, in Argentina. Ezequiel García Elorrio is a doctor specialized in internal medicine and a Master of Science in Epidemiology from Harvard University, as well as a master's degree in business administration from the Austral University of Buenos Aires. His education was supported by the W.K. Kellogg Foundation of the United States. Currently, he serves as the director, as we said, of the Department of Quality, Patient Safety and Clinical Management of ICS, where he leads a research group focused on improving healthcare practices and services in Latin America. In addition, he is a professor of public health at the CEMIC Faculty of Medicine, a professor at the UBA School of Public Health, and a member of the board of directors of the UBA Master's Degree in Clinical Effectiveness. With extensive experience and recognition in quality and patient safety, Ezequiel has worked on projects funded by various institutions, including the World Health Organization, the Agency for International Development, the MAPFR Foundation, and the Bill and Melinda Gates Foundation. He has been associate editor of the International Journal for Quality in Healthcare and played an important role in international initiatives such as CLI-CSS and ISQUA. In addition to his work at ICS, he collaborated as a consultant in different organizations and countries, bringing his knowledge and experience in clinical management and quality improvements to hospitals and health entities in Argentina and throughout the Latin American region. Thank you so much, Dr. Ezequiel García Elorrio.
So, good morning, good afternoon. Greetings from Buenos Aires. It's a pleasure to be part of the Global Health Network. That is what I cherish the most now, to join you today. Thanks for the invitation, Himali, and all the organization of this webinar. I will try to briefly, as said, to share with you some comments about policy and engagement, and that will be the lead for my colleagues that will present after me. The next, please. So again, I will try to provide you with some information and definitions about engagement and its relation to policy, because we are all trying to make change happen around the world, and we need politicians to be engaged in what we do. So that somehow, I would say, I understand that MESH is trying to besides making every one of us to be engaged in changes, we need to, for the health system to adopt these changes. So I will try to provide that perspective to you. Again, why study the politics of health? Again, these health systems are run by politicians, and we need to understand their thinking and how to contribute to their change, to the change that to happen. And finally, how to apply those changes. Next, please. So this is a picture I took last week in Lima, Peru, Peru in South America. It's a meeting of where it was run by the IDB. The IDB, it's a cooperation bank, international cooperation bank in Latin America. It's like the World Bank, but mostly oriented to the Americas. And in that meeting, we gather ministers of health from different countries in South America. In the picture on the left, there are a couple of them, some of them from Argentina, and representatives from Peru, Ecuador, and Uruguay in the region. And with them, we share some, I would say, evidence and some findings for research projects that have been run in the region, try to improve health systems. So with that, the IDB and the Quest network that I will introduce in a minute were trying to promote the adoption of evidence and try to engage them in the implementation of those changes. It's not very common for this to happen, and that's what I'm sharing the picture, and it's kind of fortunate that this happened last week. But again, it's an example of what we should be doing around the world to make change happen. Next, please. So some definitions is the differentiation from participation, engagement, and involvement. All slides are already shared with the organizers, and I have provided citations to everything I said. So I just try to bring this paper to you where some definitions are clearly explained in the slide, but mostly since we all came from the research world, trying to how identify the best way to engage among ourselves, like the TGHN is doing around the world to improve capabilities for people all over the world. And for that, hopefully try to engage and involve the findings of research, among others. So the piece of the differentiation from engagement to involvement is critical. Of course, people could change in the process. We can be talking about users, citizens, patients, clinicians, researchers, and eventually policymakers, but it's important to make the distinction. Next, please. So these next two slides were taken from a lecture that I took from a professor in public health that works, Kevin Crook, that works in how to make politicians to adopt evidence on how to make change in health systems. So it's important that, again, I like these definitions about politics, about who gets what, when, and how societies make collective decisions. This is critical because all the findings that hopefully we are getting and we are producing, the evidence we're producing, could be eventually left to nothing. So it's important that we understand the dynamics of politics that hopefully will provide the soil for these changes to happen. So political science is, of course, the science that's trying to describe and analyze the political and especially governmental institutions and processes. So again, we need to have people that are more related to political sciences hopefully help us in how to make change happen. And it's important that, again, we understand that political science and politics influence our study of health and health systems. Next, please. So again, unfortunately, politics are not well studied in life sciences like medicine. Again, we need to understand politics around different countries, different contexts. And for that, if we want to make big change to our health systems, we need to understand politics the right way. Next. So for that, we have some methods. We need to first understand players. And we have in the health systems a landscape of people that are an environment of people that are of actors that are interacting, like political leaders, other governmental agencies, and the one related to health, the citizens that participate either through elections or through the representatives in chambers of Congress, for example. And with that, we have another actors like donors, corporations, multilateral organizations like the banks that I just mentioned. And with that, finally, we have people that are related to the science of political communication, policies, and programs. So here you have I would say, stakeholder mapping in general of who are the actors that we need to approach and which are the ones that hopefully we could influence and engage to make policy decisions from our research findings. Next. So again, I pasted the link of this book that was published about 15 years ago from people from Harvard School of Public Health. And I would say that it's an interesting description on the process on how to apply political analysis to health reform, because every country of the world is looking for health reform in some way, because we're all trying to improve the way health systems are delivering care, and hopefully apply the research findings that we produce, for example, in the Global Network and other research groups around the world. So this book provides 6 steps, next please, that are to first to define the audience, the client of these reforms at the problem, identify the policy, solutions to promote, describe the context of the policy, conduct a stakeholder analysis as shown in a quick map 2 slides before, and design a set of political strategies that we need to understand and do, because if not, our research again will be left behind and forgotten. And finally, to assess the political feasibility of your policy using these political strategies. This is a roadmap. Of course, there might be others, but again, to engage and to produce change to happen, we need to have a method. Next, please. So also have in mind, I included a picture of stethoscope in this slide, because I learned along years that politicians are the best doctors, because they know very well what people want. So it's critical that we keep listening to the voice of the people. And again, we need to align people's interests to politicians' interests and to our findings. So we need to, again, understand what each stakeholder wants. And we need to have a list of people that hopefully we can approach and engage in our dissemination of research findings. Next, please. So here's another model that's trying to describe the process of how to engage, how to engage researchers and hopefully findings from those research that would translate into policy. And here you will see the flow of research on how to engage the public and eventually other researchers in the findings, and eventually try to engage finally when we try to develop and deliver the research findings into policymakers, community organizations, healthcare practitioners, and hopefully have a feedback from them on how those findings could be applied to policy in implementation. So again, that's another reference of the model that we can use. Next, please. And now going to a couple of examples. I work in something called the Quest Project 2. It's another research network that is trying to produce evidence to improve quality of health systems, trying to apply all what we know about how to improve care and how that care to be delivered in a consistent way. So on the right, you will see a couple of papers that were written in a plane by one of my fellow mentors, Dr. Margaret Crook from the School of Public Health in Harvard. And we both wrote the way where we could approach a province in Argentina, and that province was very interested in trying to identify improvements to the health systems. So trying to approach the province of Mendoza, which is on the far left, on the Gobierno Mendoza, which is a province in Argentina. This Minister of Health wanted us to review the way healthcare was delivered in particular conditions, and that care, and those findings will be used to improve health systems. And from those 2 pieces of papers on the right came regulation, because the findings of our assessments and discussions with them led for the government to promote laws across Congress, the provincial Congress, that hopefully are changing the shape of health systems. So the findings from our assessments and hopefully research findings translated into policy, which is all the cycle that we need to hopefully all flow across to make change happen. Finally, 2 more slides and we'll end. So this is a reference. Next, please. And the other thing is that we all came from the research and implementation world, and we want change to happen. But the other thing that I just wanted to include in my presentation is that we just shouldn't forget the public. This is an advocacy path to legislation, and this is in Spanish just pictures. That the picture in the middle represents a mother that it's promoted changes in the health system care delivery model because her son died from a potentially preventable adverse event. So that advocacy piece in just trying to bring the demand from people aligned to research findings is making change happen in my country through the policy of, through changes in policy and hopefully the way care is delivered. So I just discussed the usual path of research findings to policy, but I also want to bring up the case of the public demanding and changing health systems. Finally, next one. So my personal insights are that we need to have a good choice of where to deploy changes. Sites and I would say the level of maturity are critical of the sites where we would like to apply those changes. Then we need to mobilize, those just changes because there must be a willing to change. Then we need a vision based on evidence, since we came from research, to guide these changes. We need a method to make changes to happen. We also need a conduct to persist until changes become a reality, because changes very difficult, as we all know. And finally, we need a measure to assess the impact of these changes and hopefully have a learning attitude to sustain the changes a long time. Because the most difficult thing to happen related to change is sustainability. So again, thanks for the invitation. I just tried to provide you with some definitions, some references around political science, and hopefully methods to make engagement to policy, and a couple of examples from my country. Over to you, Himali. Thank you. 10 minutes.
Perfect. Thank you so much, Ezequiel. Thank you for your presentation. Please keep all questions for Ezequiel for the end. We'll take all the questions in the Q&A box. Actually, if you do have any questions right now, you can type them out in the toolbar. There's a Q&A section. You click on the Q&A, and then it shows a place where you can type your questions. So please do that. Our next presenter is Fatuma Guleid. Fatuma is a researcher and doctoral candidate at the KEMRI-Wellcome Trust Research Program in Kilifi, Kenya. Over the past couple of years, she has been involved in knowledge translation initiatives, supporting the uptake of research findings within her organization. Her experience includes developing and implementing knowledge translation strategies, collaborating with policymakers to create evidence-to-decision frameworks, and training researchers in effective knowledge translation techniques. Currently pursuing a PhD focused on reframing knowledge translation for health policymaking, Fatuma is committed to advancing the field of knowledge translation and ensuring that research makes a meaningful impact on society. Please, Fatuma, your presentation. Thank you.
Thanks so much, Himali, and thanks, Ezequiel, for the great introduction. So following on from Himali's, talk, I'll be sharing a little bit about our organization's approach to and the experiences that we've had with policy engagement. So I'm at the KEMRI-Wellcome Trust Research Program, and the way I've structured my talk is that I'll start by sharing a little bit about who we are and what we do, and then I'll provide some contextual background just to give you an idea of the kind of landscape within which we are working. And then I'll tell you about our approach to doing policy engagement, provide some examples of our work, and then finally share some lessons that we've learned over time. So KEMRI was established in 1989 as a partnership between the Kenya Medical Research Institute, which is a state corporation in Kenya that's focused on doing health research. We are also partnered with the Wellcome Trust and the University of Oxford. So in the beginning, our primary focus was on malaria, including studying the disease burden and immunity to malaria. But today the program has evolved considerably into a research facility that's conducting multidisciplinary work as shown here. And this work spans across several key themes, including pathogen biology, where we try to understand the characteristics of pathogens and behavior of infectious diseases. We have vaccinology, where we evaluate and develop vaccines for infectious diseases. We have a robust clinical research unit, which conducts clinical trials. We do conduct health systems research with the aim of improving or strengthening health systems. And then finally, population health to analyze health trends and identify determinants of health. And so all these themes are interconnected, and our research often draws from these different disciplines. But importantly, to support all of these themes and the research that we do, we have established 4 robust platforms. This includes obviously the labs where we do our basic science work. We have a demographics and surveillance platform for collecting and analyzing population level data. We have a clinical research unit, which is dedicated to conducting clinical trials. And then importantly and more relevant to this talk is the public and policy engagement platform, which is which is embedded throughout the program. And the point of this platform is that we educate and inform the public to raise awareness about health issues, but also to facilitate the translation of the research that we do into policy and practice. And so today I'll be focusing on the policy work specifically. Next slide, please. So before I delve into our engagement strategies, I think it's essential to have at least a general idea of the broader policy landscape within which we're working here in Kenya. So Kenya has a national government and 47 county governments. And so health is a devolved function, meaning that the counties are responsible for delivering health services. But the responsibility of developing health policies is at the ministry, at the national level, which is by the Ministry of Health. And the county governments adapt these national policies to their various counties. And this type of governance structure obviously presents both opportunities and challenges for policy engagement, but we can discuss that later. But the other thing that's important to know is that there are several key health policies or health agendas that have been driving health reforms in the country recently. And the kind of overarching health policy that guides how we health in Kenya is the Health Policy 2030, which was developed really as we were moving towards this push for universal health coverage. So everything that we do really just aligns to the Kenya health policy. The other important thing to note is that evidence-informed policy making has gained a lot of traction in Kenya. There's growing appreciation for the use of research evidence in policymaking. And this has culminated in a research unit within the Ministry of Health to support evidence-informed policymaking. And so this is really great for us because it means there's recognition for the importance of research in policymaking, and it gives us a good into the policy space. Next slide, please. So given this context, it's clear that for us, policy engagement is very significant and it's important. Being a state corporation, we're actually mandated to support health in the country by providing research evidence and expertise and sharing that with the Ministry of Health. But also, if we consider all of the work that we do and the resources that go into doing that work, it's important that our research isn't just academic, but actually has an impact on people's lives. And because of our history and institutional role, we've always been doing policy engagement, even though we may not have termed it as such in the beginning, but that had always been ad hoc and project-based. And so as our program has grown and evolved over time, we've recognized the need for a more structured and institutionalized approach to policy engagement. Next slide, please. So that led us to developing a policy engagement strategy or goal, and the goal of that strategy is to develop and nurture partnerships between researchers and policy stakeholders that enhance the quality of health sector policies through evidence-informed decision-making. And this goal just describes the change we hope to contribute to through our policy engagement activities or strategy. Next slide, please. So how do we hope to achieve this goal? Well, we have these main activities as part of our strategy, and we usually use them in a kind of multi-pronged approach. So we synthesize evidence, we produce and synthesize evidence to give policymakers a clear picture of what's out there in terms of the research. We work together with policymakers on research projects and co-produce research with the hope that the research we're developing is or the research we're producing is relevant and actionable. We embed our researchers into policy spaces such as technical working groups or advisory panels, so that they are within those spaces and they know what's going on there. And then we talk, we facilitate dialogues and workshops, consultation meetings, and other forums to share our findings and feedback, and also to hear from the policymakers and the other policy stakeholders. And so these activities really for us are like the gears in our policy engagement machine that work together to bring us closer to our goal. Next slide, please. So we saw these activities as influencing behaviors and attitudes of our policy stakeholders in several ways, one of which is by increasing the availability and accessibility of evidence, then the users might be more likely to use it. The second is by building the capacity for both researchers and policymakers for policy engagement processes and evidence use processes. So in order for policymakers or research users to use evidence, they need to have the capacity to do that. The third way is by improving the motivation and the attitudes that policymakers and other research users have to actually use evidence, but also motivating researchers to engage in policy engagement processes, because often they're not as incentivized, and we'll see that a little later. So we want to show policymakers the value of using evidence in policymaking. And then finally, which is really important, is strengthening relationships. Through our activities, we're hoping to strengthen relationships, which then foster trust and mutual learning and understanding between us and our users. And so we believe that by cultivating these qualities, we can promote an environment that is suitable for evidence-informed policymaking. Next slide, please. So who do we engage with? Well, we engage with many people. Essentially, we try to target the people who are in a position to make decisions about a particular issue, and the people who would be affected by those decisions. This includes policymakers all the way to the public, the media. And I've highlighted a few here, but there are many more, and often we will engage, who we engage with depends really on the issue and the broader context. Next slide, please. Okay, so before I share some of the outcomes that we've had with our strategy, I just want to point out that we also started studying policy engagement in a bid to improve how we do policy engagement. And the idea here is that we conduct studies to learn how best to engage with policy, and this informs our practice, but at the same time, our practice informs our policy engagement research. So these are just two recent studies that I'm highlighting that we completed recently, one of which was a pilot policy engagement study where we tested and evaluated our policy engagement activities, the ones that I mentioned previously. And the second is work that we did on the use of mathematical modeling data to help make public health decisions. And this actually led to a co-developed framework to guide the use of mathematical models in low and middle income countries. Next slide, please. So what have been some of the key outcomes? Just putting some here, but mainly we have supported the development of malaria control strategies. Like I said, we started doing a lot of malaria work. We have also informed epilepsy action plans. We have informed neonatal and child health guidelines. We have supported development of health benefits package at the national level. And I'll talk about that a little bit later. Next slide, please. But the other thing that I'd want to just point out is, in as much as we may have contributed to changes in policy, we've also had impact in intangible ways, like increasing our credibility as an institution that provides evidence and strengthening the trust that policymakers have, which then in turn contributes to our meaningful inclusion in policy spaces. We've also seen an appreciation for research and a strengthening of the relationships that we have with our policy stakeholders. And so even though these are not, the kind of policy changes or impact that people usually look out for when they're doing policy engagement, these kind of, I guess, soft outcomes or impacts are really important because they are the building blocks for impact long term, but they are also quite difficult to measure and they can remain hidden for long. So it's important to consider them, I think, when we're also counting our successes. Next slide, please. So to illustrate these points further, I'm just going to highlight 2 examples of some of the policy engagement work that we've done. The first is the COVID-19 pandemic. Next slide, please. So KEMRI played a significant role in supporting the government's response to the pandemic. We produced research to answer some of the questions that policymakers had. Our researchers shared their technical expertise within several task forces. We supported also in other ways by testing for COVID-19, by carrying out genomic surveillance of the virus, and so on and so forth. We also formed an evidence synthesis group with the research unit at the Ministry of Health to co-develop evidence briefs, which we routinely disseminated throughout that period. And this effort led us to informing lockdown measures, COVID control strategies, and later informing also vaccine rollout strategies. And so, I mean, looking back and all things considered, this was a successful policy engagement effort, at least in my opinion. And there were several things that worked out for us, which made it successful. Some of which were the building blocks that I talked about in the previous slide, like having existing relationships and building that trust and understanding with policymakers. But also COVID was perceived as a technical issue and it was an emergency. So governments were scrambling to control it, obviously. And for such a biomedical issue, what is perceived as a biomedical issue, people usually look to scientific research to understand and solve them. So there was a high demand for research at the time. And because the impacts of COVID were far-reaching, you know, policymakers were more inclined to listen to the evidence that we give them, or the evidence to guide them. Another important thing that worked out for us was having policy engagement structures and resources in place at the time. So we were able to respond quite quickly. And that's because just before the pandemic, we had started doing the policy engagement study that I talked about a little bit earlier. And so that meant that we had the structures, we had the resources, especially the human resources, to support policy engagement activities. The other essential thing was our ability to be flexible and responsive. So we were able to quickly pivot our research and our researchers' expertise to address the concerns at that time. And so that was really crucial. Next slide, please. But the COVID-19 context was quite unique, again, because I said it was an emergency. So I also wanted to share with you our experience doing policy engagement work for an issue that wasn't as straightforward, and that's the development of a universal health coverage, health benefits package. So next slide, please. So a health benefits package, essentially is a package that defines the specific health services that an individual in health facilities can access without paying out of pocket. So that's usually paid for by the National Health Insurance Fund. So developing a health benefits package involves making careful decisions about, you know, which services to include, how to prioritize them, and how to ensure that there's equitable access. And so you want to use evidence, or you want to be informed by evidence to do this. So for this case, we had our researchers being a part of the Universal Health Coverage Benefits Package Advisory Panel that was formed by the government. This panel was tasked with developing the benefits package. And so the main role that this group of researchers played was to provide technical expertise through supporting the costing exercises for the health services and appraising evidence to help choose which service would be included in the package, among other things that they took part in. And so some of the outcomes from this exercise and our involvement included, of course, the development of the benefits package. A little way downstream, we also informed regulation on developing and revising benefits packages by using these evidence-informed methods. And there was also an all-round appreciation for evidence, this priority setting exercises that are evidence informed. And we know that because a few years later, the same group was called in again to develop a new benefits package. So some of the recommendations also made by the advisory panel were implemented, which led to changes in the National Health Insurance Fund at the time. But ultimately, the benefits package was not implemented because of political factors or politics. So I'm sharing this experience because it highlights, I think, both the successes and challenges of policy engagement. So on the one hand, we successfully contributed to the creation of the comprehensive benefits package, but the fact that it wasn't implemented, that was influenced by a range of political factors that were out of our control. And so that gets us really to think about understanding what success in policy engagement looks like. So while direct application of evidence may be what is desired, there are many other ways in which we can have impact. There are many other ways of defining what success looks like. So like I said, the group that worked here were also called upon again to develop another benefits package for a reformed social health insurance a little while later. So I guess the point here is that it was important that the success of our efforts have impact down the line, or it could be long term, and we need to constantly reflect on that. Next slide, please. So finally, I'm just going to share two key takeaways from our experience. The first is that you really have to consider the issue you're addressing and the broader political and socio-economic context within which you're working. So, I mean, it's important to understand the actors on the scene, the current political context. You have to map all these out for an successful or an effective PE strategy. You also need to be flexible and adapt to that context. And this is something that I find that we struggle with a bit within the research field because our timelines are very different. On the way that we work and our culture is very different. But because policy work takes time and the context and people in it are always changing, we have to be flexible and responsive. Next slide, please. The final takeaway, and I cannot emphasize this enough, is the importance of relationships. So relationships are really the backbone of policy work, whether they're formal or informal. Strong relationships, they open doors for you. You end up building trust and facilitating mutual understanding and learning. And you build these relationships by constantly engaging with policymakers and sustaining that engagement. And you also collaborate with them and work with them so that they also build capacity and have an appreciation for the work that you're doing. But building and nurturing these relationships obviously takes time, and researchers are not always incentivized to spend their time doing this, especially when impacts are really difficult to come by or difficult to measure. The other thing is there's always a high staff turnover in the policy, like in the ministry, for example, which means you're constantly building new relationships. And so it's challenging to constantly do this, but it's something that we need to work on. And so some of these challenges can be overcome by formalizing engagement between researchers and policy institutions, which is what at KEMRI we are striving to do in the future, or as we go on. Final slide, please. So to summarize, I think we've explored our organization's policy approach to policy engagement. We've highlighted the key strategies and outcomes. And so I hope that this has provided some insight. But looking ahead, I think I believe the policy engagement, just as Ezequiel said, will become even more important or more critical as we face pressing global health challenges. So it's something we definitely keep seeking to improve upon and learn about. So yeah, thanks, Himali. That's it.
Thank you so much, Fatuma. Thank you for your presentation. Our third and last speaker is Soumitra Pathare. Soumitra Pathare is the director of the Center for Mental Health Law and Policy. He is a psychiatrist the Center for Mental Health Law and Policy is based in Pune, India. Soumitra's primary interests are in the areas of mental health policy, scaling up mental health services, suicide prevention, and rights-based care and litigation. In the past, he has provided technical assistance to the Ministry of Health and Family Welfare, Government of India, in drafting India's new Mental Health Care Act 2017, which takes a rights-based approach to mental health care. He was a member of the Mental Health Policy Group appointed by the Government of India to draft India's first national mental health policy, released in October 2014. Soumitra has served as a WHO consultant in many low and middle income countries, including Botswana, Seychelles, Lesotho, Samoa, Vanuatu, and Eritrea, Guyana, Grenada, among others, to assist them in drafting and implementing mental health legislation and national mental health policies. He is currently the co-PI on multiple projects at CMHLP, including suicide prevention projects such as Outlive, Engage, Spirit, and Contact and Safety Planning. Soumitra has conceptualized and steered various innovative community-led mental health interventions and strongly believes all persons with mental illness should be able to fully participate in society as everyone else. Thank you, Soumitra, for your presentation.
Thank you, Himali, for the invitation to speak, and thank you to all the organizers. I'm not going to have any slides because I sometimes I feel that you can suffer slide fatigue on many of these webinars, and also I'm going to really speak about a kind of distillation of my experiences of being engaged in the policy work for the last 17 to 18 years, and what I've learned out of that. I'm going to primarily focus on our work or learnings from our work in India, because I think it's important to understand that while we seem to think of policy processes and policy methods as being similar across the world, there is a huge cultural context to how policies get made. So what might work in one country may not necessarily work in another country. And even in the, even if you look at regions, it may not work in some regions, it may work in some regions. And how policymakers engage, and in many ways, some of the things that you heard Fatuma say earlier, I can completely relate to very well with that, especially issues around having personal relationships or developing formal and informal relationships with policymakers. But there are a couple of points that I wanted to highlight for researchers, especially what I've learned when I talk to other researchers or clinicians even who engage with policymakers. The first is the issue of evidence. We all believe that evidence-based medicine, and we would like to see policy driven by evidence. Now, the question is, should it be evidence-based policy or should it be evidence-informed policy? And these are two very different things. And it's important for us to remember that very often you will end up having evidence-informed policy at best, and purely evidence-based policy does not work. The other thing that we find when we engage in policy with policymakers and the issue of evidence is that a lot of the evidence that is produced, a lot of the scientific evidence that has been produced and which is quoted by researchers to policymakers is actually not trying to necessarily answer a policy question. So what you're trying to do is that you have scientific evidence which has been produced for the purposes of science, and you're then trying to adapt that evidence to try and answer a policy question. So frequently, policymakers do not then kind of appreciate your evidence because it does not actually answer their specific policy question. The other issue is that policymakers frequently want a very concrete and definitive plan of action. And as scientists, we always have this thing that we say, well, to the best of what we can say just now, this is likely to happen. And that kind of answer is frequently not acceptable to policymakers. They want you to give them a very clear black and white answer. And what we found over time is that instead of getting stuck into that black and white, yes, no kind of thing, what we try to do is to give them a menu and say, look, here is a menu of choices you have. These are the positives of this, and these are the negatives of this particular choice, and so on and so forth. So you actually give them a menu of choices with the pros and cons for each of the choices, and help them arrive at a decision. It also helps to convey to them that the evidence and science is not necessarily always just a black and white issue. The third thing about evidence again is that what is understood as evidence by policymakers is frequently at variance to what you and I as researchers or people who come from the scientific background understand as evidence. So we might be very focused on what we call objective evidence. Evidence that has been produced using very objective scientific methods. The reality is that policymakers actually give a lot more importance to what you and I might call subjective evidence, which means a personal testimony frequently has a lot more value for a policymaker than just you and me producing or providing them with a presentation with lots of data and lots of outcomes. And personal testimonies frequently, and you saw from Ezequiel's presentation to the last slide, that frequently a personal testimony of an individual who's very driven is probably going to bring about a lot more policy change than just a group of people of science trying to get policymakers to look at the scientific evidence. And that really brings me to the other issue, which we as researchers don't do very well, is that we do not really engage with civil society and the general public to actually educate them, if I can use that word, is probably a wrong word, but to actually get across to our public and to our civil society as to what is the state of evidence and what is probably likely to work given the current state of scientific knowledge. And since we don't do that, frequently the ask that is being made by civil society or the ask that is being made by prominent champions, there are other stakeholders such as caregivers, people with lived experience, and the ask that they might make might be at variance to what is the scientific evidence. And so if we really want to engage policymakers, sometimes the route to engaging policymakers actually goes through engaging civil society and engaging people with lived experience. So, you heard Fatuma talk about the various stakeholders that are present in the system. And it's very important that you engage with those other stakeholders in the system rather than just say, oh, we need to get policy change. Let's focus on the policymakers. And that doesn't necessarily work always. So it's important what kind of evidence and who presents that evidence and how is that evidence presented to policymakers. That makes a huge difference. The second point that I think other speakers have made, and I think is very important, is the time frames. Policymaker time frames and researcher time frames are very, very different. Most policymakers, I'm talking of India, are usually in a position for about 3 years or so before they will get transferred to another position. So they have a time frame of 3 years in which they can do something, and if they are interested and if they are so inclined. Whereas frequently researchers do not necessarily offer solutions or have policy asks which can be achieved within that time frame. And so that creates a kind of mismatch between expectations, what researchers or us who engage with policy work have versus what is potentially the policymaker's perspective of what should be done or can be done. And so, that really does make a difference as to what you should be asking for, when you should be asking for, and how you should be asking for. One important finding I've had from India, I don't know if this applies to other parts of the world, but a lot of researchers and clinicians, tend to we tend to kind of look down upon policymakers and politics. It's somehow seen as some kind of a messy thing into which we don't want to get ourselves in and get our hands dirty. But look, the reality is that it is a messy business. It is also important to realize that policymakers are actually sometimes are actually most of the times in most countries the smartest people in that community or in that society. Okay, they usually are not, they frequently might be actually smarter than a lot of the scientific people whom they are interacting with. So I think there's a certain, what I'm asking for is that we need to have a certain amount of mutuality and mutual respect, not fear, but respect for the fact that policymakers, understand things. And remember, they actually have a lot more competing priorities to deal with. Fatima mentioned this too, and I think Ezequiel said that too, that, there are different pushes and pulls. There are challenges from within the health sector. They have competing priorities they need to address. Within and between sectors, there will be competing priorities to address. There's also the politics of what a particular individual politician or a policymaker might have as their own pet idea that they want implemented, and then how do you kind of mix that all up? And then finally, the issue of available resources and how do you apportion those resources. And all of these are very complicated, messy problems which have messy answers and messy solutions. And there's no single right way to solve it. So, I'm going to summarize now in a few things and just go through a list of points that you might want to take away when you go home from here. Is that first of all, policy making is much more than just scientific evidence. There's more to policy than just scientific evidence. Policymakers understand uncertainty, but we need to actually present that uncertainty in a certain way. The third important point to remember is that all policymakers are not, it's not a homogeneous group, okay? There are lots of variations within that group. It's extremely heterogeneous. Finally, remember that policymakers are humans too. They are people, and all the kind of things that drive human beings and people also make a difference. So going back to Fatima's issue about having interpersonal relationships, both formal as well as informal, are very important. Ezequiel started his, I'm going to end with that, because Ezequiel started his presentation with a very structured way how you could go about making policy. And when we started doing policy, engaging with policymakers, that's what we did. We said, okay, we are going to learn this. It's a bit like we learned how to drive a car. We got in and learned how to drive a car, and we thought, that's it. We're very confident we can drive a car. And then when you get into the real world and drive, it's like having to drive a car on one of the Indian roads. And if anyone who's visited India, they will know what driving a car on an Indian road feels like. It's nothing like what you might have learned from your books, and it throws up challenges that none of your books ever experienced. Actually getting engaged with policy is most important. So, knowing the theory of policy engagement and getting your hands dirty and getting in there are very different beasts, so as to speak. And once you get your hands dirty in there, you'll realize that not everything that you learned works, and you need to be able to think on your feet. I'm going to stop here. I don't know if I've used up my time, but I do know that we are running a bit late. So I'm going to stop here. Happy to take any questions and hand you back to Himali.
Thank you so much for that, Soumitra, and like Al says, for articulating very well the complexity of what we're discussing here. Okay, so thank you everyone for those presentations. Now, I think maybe I'll just start off the question and answers by prompting some discussion amongst ourselves. The first question I'd like to ask, just for reflection among each of you, Ezequiel, Fatuma, Soumitra, is something that has come up a few times in your presentations, and maybe more just now. I'm wondering if we can reflect on what the relationship is between community engagement and policy engagement. So MESH is the community engagement platform of the Global Health Network. And so I think some of our audience here as well will be particularly interested in this. What is the relationship for researchers engaged in this field between these these commitments, also commitments to the community, commitments to better policy? How do those commitments meet? And what's the relationship between community engagement and policy engagement?
I don't know who likes to go first.
Ezequiel, if you'd like to say
Ezequiel, go
something,
ahead,
sure.
yeah.
No, I feel it that unfortunately for the moment, there's separate stages where hopefully the communities are involved in, I would say, shaping research, research projects or findings or application of those findings into policy. And then you have the process that Soumitra explained that very well on trying to engage politicians in making some use of the evidence that hopefully would be of impact for populations. So I have the sense that community engagement, it's something that it's becoming, I would say, a must for all of us that do research in terms of trying to be sure that we're not delivering solutions from the skies, is that we engage the users of the field that will use this evidence in their daily lives in order to shape it the right way. That's one piece. And the other piece is how to translate research findings into policy. And hopefully in the future, we'll have the community engaged in how these policies are really shaped. So that will be a further step. Hopefully that happens. We are working now in a project that is trying to use co-design and co-production as strategies to improve the way research is delivered for the project, but also to improve health systems. So hopefully we're seeing the bridge from community engagement to policy engagement. I don't know if it was clear, but my colleagues agrees. Thank you.
Thank you.
Okay.
Yeah. Fatuma, were you going to
Oh,
say
you want
something?
Fatima? You go ahead, and I'll go after you.
All right, thanks. So I was just going to say that we also do a lot of community engagement and for different purposes. But so I'll just focus on for policy work. And I think when it comes to thinking about engaging with the community for policy, you have to start seeing them as policy actors or policy stakeholders. So they are part of that ecosystem. And they're very important because they're the ones who are being affected by the decisions that are being made at policy. So you need buy-in from the community, and you need to ensure that their needs are actually being answered. So it's a key part. It's very important to engage with them and to have them on the table as well. Unfortunately, sometimes as researchers, we may not have the power to bring community members to the table, the policy table itself, because that is, a kind of a closed space. But we have to find ways of doing that. And one of the ways in which we use a lot here is to involve civil society organizations or patient advocacy groups, and those types of groups within our discussions, or at least when we're having these conversations. It's not perfect. I think also here in Kenya, there's now a requirement at the policy level to have robust public participation when making laws and policies. Whether that's working really well, and I can't comment on that at the moment, but it's something that it's important. There shouldn't even have to be a bridge. It's something that should be part of the engagement, and something that we always we consider them as key stakeholders. Yeah.
Thank you.
I think Ezequiel and Fatima have said that, but what I think is, to summarize what we what the path, the way to policy engagement or the way to get a policymakers goes through community engagement. So you can't be doing policy engagement without doing community engagement. It's almost like an essential part of it. Although they're two different things, you can't do one without doing the other. And one of the things that I wanted to pick up on what I think others had said before too is people like to hear stories. Okay. So it's important that you have a story to tell. If people like stories, people like narratives. People don't remember your drab data or just facts. And so it is very important that you engage communities and our civil society to actually take that data that you have. And civil society actors are sometimes very good at storytelling. And convert that into a story, which can then be presented to policymakers. And you weave the evidence into the story. And that I find works very well. And to get, because you could say the same thing in dull facts and you could actually present a very nice story, and that gets people's attention and interest. And we don't do that. We don't do that very often.
Soumitra, when you say civil society, though, it would seem that these are people who have more of a public voice than say other groups that may be engaged by researchers and community engagement. The community that you're talking about, that you must go through them in order to reach policymakers because they're being heard by policymakers, sounds like a very particular group of people.
Not necessarily. They could be there are lots of people. There'll be some of them might be low-level political functionaries, for example, and like, for example, village council heads, for example, who are in the political space, and they might be at a lower level in the hierarchy, but actually do have a lot of influence. And we need to kind of engage with them, even if they are political in nature. Then there are large civil society groups, and usually user groups who have a lot of influence on policymakers, who do a very good job actually engaging policymakers than scientists like us do, because engaging policymakers is their primary remit, in a sense, whereas that's not a primary remit for a lot of people in science. Your primary remit might be to do research and engage the scene as a side hustle that we are trying to do because we want to get our science. So they are actually good at policy engagement. So there's a lot of such groups we should be engaging with. And finally, I think really need to actually do a lot of, we talk about co-production and co-design and all of that. But we need to really engage, the process with policymakers can't be a one-way thing where we are trying to tell them to do something or give them stuff. It needs to be a two-way process, which means we need to also be asking them, what do you need from us? What can we do for you that will help make your life easier? That will help give you information that would be useful to you, and actually start designing our research to also start answering some of their questions, and not just completely be focused on this is what we found and why don't you do what we found, attitude that we frequently take when we engage with policymakers.
Thank you. Thank you, everyone. Yeah, those were really rich answers. The other question I had is how do we evaluate success? I think this came up also in some of the presentations. How do we have a process-oriented view of what success is? Is success the formulation of policy that we like? What is success in policy engagement?
I don't know. Ezequiel, you have more experience of this. You will probably want to go
No,
try
it seems that
answering.
you are much more experienced than me, Soumitra. You're very humble. It's I would say that first, adoption. All of us may count our successes, I would say, not by the number of meetings we have with policymakers, but for the numbers of law pieces that hopefully you have influenced it. And there are quite few along our lives, probably. So I would say first, and I live in a country full of laws. There are lots of laws, but not many of them are implemented. So first is the conversation, then is the approval, as I would say, adoption of a particular piece of evidence or interest that we have into law, and then hopefully that this produce change at the health level of the populations, which is difficult to measure and also difficult to sustain. I would say that it's a never-ending fight, and we need to keep pushing and I would say pursuing for different angles. Who knows? There are countries which are, my country in population is much smaller than India, for example, but they have similar problems, which each state is very powerful in terms of independency. So what will work eventually in one county in the south, in one province in the south or state in the south of India might happen in the north. So it's difficult. But again, so conversations, adoption, and eventually impact and sustainability. But very difficult to count the success on that.
Thanks, Ezequiel.
I think Ezequiel has summarized it very well. I don't think there's anything more that I would want to add. And I think it is difficult to measure success, and that creates a lot of problems, especially when you're talking to the other side of the equation for us, which is funders. When we go to funders and say, look, we need funding for policy action, and they are very clear about, okay, what is the outcome you'll get? What is success? How are you going to measure it? And there are no easy measures of success which can be presented to funders. And so that's a challenge. It's a challenge for funders. It's also a challenge for us to convince funders to be able to give sufficient amount of resources for the policy action. I can see Fatima nodding her head, so maybe she wants to come in at this point.
Yeah, I think there's this on us as researchers to show that we are having impact, and the way that impact is defined by funders or by other people is quite narrow. So I mean, if you tell people, yeah, I had these conversations and I had all these meetings and I think I'm building a relationship, nobody really sees that as an outcome or as a success, even though I think to me it is a success. And this is something I mentioned before, is because policy engagement is very relational work, a lot of the times the impacts remain hidden, and they're long term. So the other thing that we don't consider actually when measuring success, whatever that may be, is the time it takes. So we usually just do cross-cutting evaluation or things like that. You don't consider the fact that policy change or policy work takes long. And so you might need to monitor this situation or evaluate over a longer period of time to actually see some impact or some change. And then there's that tension about your policy engagement activities may have been successful. Like I mentioned, working within the advisory panel that was tasked with developing a health benefits package. You did have the package at the end of the day. So you are successful in a way. But if it's not implemented, as Ezequiel was saying, did you have any impact? But then do we then cancel that out as not having been successful? But I think also when thinking about success, one of the things from my reflections that I struggle with is how far you're willing to go. Because as researchers, we have a role to play. And often, especially if you consider your role as solely being evidence provision, you don't want to cross that line into advocacy because you want to seem as impartial and as objective as possible. But that doesn't work so well in the policy world. Unfortunately, when you're in policy, you have to play political games as well. You have to be part of the politics as well. And that's something that researchers shy away from a lot, and for good reason. But that's how, advocacy and, understanding interests and influence, those are the things that change, I guess, the game. But as researchers, we have to really consider what our role is, how far we're willing to go to see this success, which is adoption and implementation. And sometimes we're just not there. So, and we don't even have the resources anyway to do that a lot of the times. So it requires, I don't think it's a black box, and I don't think it's something that we will figure out. It's something that's keep evolving, the idea of success for policy engagement, but it's something that we need to think about, yeah.
Right. Yes, please, Ezequiel.
Quick comment. And we need to acknowledge that we all belong, we are sharing experiences from countries which are, I would say, in the way to development or to be more formal established. So probably some countries have more, I would say that probably countries are, I'm not sure it's called advanced, but far ahead on terms of governance process. They may have formal processes to try to engage community and try to bring people to the table to give opinions on decision to politicians or decision makers. Every country has its nuances, its context, but again, we are trying to push ahead this process, but probably our economical and socio-political contexts are providing more challenges than other countries to make this happen. Probably for a future gathering, I would say that maybe we can bring someone from a more established political system that could show us examples that could eventually contrast with our views. But again, we all live where we live, and we need to make things happen in where our context. But again, having examples of maybe more developed groups could be of interest. Just
I think we're also most of the world.
Yes, no, but I understand. But anyway, we can always learn from anyone. Yes.
Of course, of course, of course. Thank you all for such thoughtful reflections. This is a really rich conversation. I'm so happy. And I think what I'll do now is we have about 17 questions. I wonder whether I should just quickly start summarizing some of the questions, and then some of them are for each of you. Maybe you can just note down some of the questions for you and then answer them at one go, maybe? Should we do that?
But questions directly for each of us?
Well, yeah, the first one is about Argentina's history and political landscape. It might. This looks like maybe
I would say I already answered that. The issue with large countries in terms of surface or extension is that they're federal, and that it's difficult to. Sometimes you can work with one state that those changes will not happen in others. So even having a national government, big, I would say, federal states are difficult to manage. So that's a big challenge. And that's a summary of the landscape back here.
Okay. So I think that addresses the questions. And there was, so Vahama Kamagate has asked the question, how can academic research contribute in promoting policy engagement? I think we've discussed that. Adane Getachew, sorry for mispronouncing names, how policy and advocacy go hand in hand. Yeah, I think that's been part of our discussion, but also I just maybe it relates a bit to what Fatuma was just saying about, what is the limits of what's the limit of policy engagement? When is it provision of evidence, and when does it go into advocacy? But in any case, I'm not sure what that question was, so I'll just go on. Many thanks for the presentation. Please, could you throw more light on the key difference between policy engagement and policy involvement? I think that might be in the slides, but Ezequiel, if you would like to take that question, then that's fine. Fatuma, how do you organize the partnership for research with academics? The partnership for research with academics, maybe with policymakers, maybe that's the question. Do we have a framework in Kenya that seeks to address social determinants of health as a key determinant to well-being and wellness? This again seems like a very broad question, maybe out of the scope of this talk, but Fatuma, if you would like to take that question, then feel free. How can clinicians engage in policy making? How can clinicians engage in policy making? As it has been observed that most clinicians were left out during COVID-19 pandemic, and if so, what can a clinician study to take full responsibilities in policymaking in the healthcare system. Okay, next question. In global health trends, in the issues of health policy, how do you monitor policy implementation, policy enhancement for professional excellence, and policies execution with health practitioners, and how do health communicators and health promoters engage the public for effective understanding and considering health information complexity? How do we harmonize health policies with the international standards and not create a conflict of interest on health policies of individual nations, particularly African societies and Nigeria? Okay, I just don't want to take up all our time reading questions.
No, but maybe we can cover those.
Himali, I think
because there are many questions. Go ahead.
Sorry, should I go on? Should I go on reading?
No, let's cover those first. I would say quickly that I would say that someone asked about engagement and involvement. Engagement is a process, I would say, maybe horizontal, and eventually the involvement seems, from what I shared, is that the full cycle to engage users, practitioners, and eventually decision makers in the process of a learning process to iterate about the implementation. I would say involvement is the aspiration that we're all aiming for. Over, yes.
Okay. Anybody else? Is there something that a question that was raised that you'd like to answer?
I mean, Himali, I just wanted to quickly say that, look, these are really very, very nice questions. Okay, really good questions. The only challenge is going to be trying to answer them in 3 sentences and 30 seconds. There are no easy answers to a lot of this. In fact, each of these questions could be the subject of a webinar that you could organize in the coming weeks or months, you know. But yeah, so I think we've read the questions. Maybe if it is possible for you to actually make take those questions down, maybe send it across to us. We could also have a look at it, because I'm just trying to look at it and thinking there's no way we can get through the.
Okay, I think then. Thank you. Okay, so I think what I'll do then is, if that, I'll just announce to all the sorry, what do we call the people who attend the webinar? It's just to everybody, all the participants, right? That's what we'll be doing. So I will copy all of your questions and send them to our panelists, and I think maybe. I'm not quite sure how the answers will get back to you, but there is a way, and so we will do that. So in closing, is there just anything else that any of you would like to say?
Well, maybe that. Not sure I could be called a researcher in all that I do, but I would say that what I'm seeing from the proposals that we're delivering and the research that we're trying to conduct, particularly, for example, the Global Health Network, is that everyone's looking for impact. I would say that findings are not enough. I just heard from Fatuma, and I know that Jacinta Singh is here. The KEMRI-Wellcome KEMRI Center is doing great. Is that we all need to look for impact in such a way that funders keep being interested in funding what we do and trying to also to help populations in a meaningful way. So for that, we need to engage populations, of course, in the design of interventions or in any way that our research works. But also we need to engage policymakers, because the impact will only come from the political system. Research will not be enough to doing that. So that's my closure comment. Thank you.
Yeah,
I think just based on some of the questions that were in the chat and also in the Q&A, it's just to say that policy engagement and working with policy, obviously it's not easy. It's very complex. It takes a lot of time, a lot of patience. And usually what you find is that as a researcher who's just starting, or if you're not, in an organization that supports that type of work, it can be even more difficult. So one of the best things to do is to, again, try and leverage networks and people who already have policymakers here, or make use of your networks as much as you possibly can, and the people who might already be working in those spaces. I think that's very important, but it's a very it can be very challenging, even for people who've been doing it, I guess, for forever. Because it's also very context specific. It's always changing depending on the context and the issue.
If I were a couple of sentences for our listeners, engage in it. It's fun. It is a great experience. It is probably as Ezequiel said, the only time that your work will really make an impact, as in change people's lives. And when you do that, be humble about it, and just be willing to learn, that willing to listen, and not just go there with ready-made answers. But more people from science engaging in policy making can hopefully only make for a better world. So yes, do engage in that process, however hard it might appear superficially.
Great. So on that note, I think we're closing this webinar. Thank you so much, Ezequiel, Fatuma, Soumitra. This was wonderful. I'm so grateful for what I got to hear today. And thank you for everyone for participating. And see you next time.
Well, thank you so much for the invitation.
Thank you. Bye.
Thank you. Thank you.